Great. Well, hi, Bridget, and thank you for joining us to be a part of our blog series on Domestic Violence Awareness Month. So you co-founded the Network for Victim Recovery of DC, or NVRDC, in 2012, with the goal of providing DC crime victims with a seamless network of referrals to needed legal support and other services in the aftermath of a crime, which is a tremendous mission to take on. And we wanted to invite you here to talk with us today at the Healthiest Cities and Counties Challenge because I think something that really stands out about your work and closely mirrors the model and the philosophy behind the challenge is how you emphasize placing power in the hands of survivors.
Yeah.
And your case management and advocacy of services really center survivors' voices within the community. And then on top of that, your team also partners with many other community-based organizations like faith-based organizations and local businesses or government agencies to achieve your mission. And similarly, our project teams are taking a community-led approach to advancing health equity by addressing access to healthy foods and access to health services while engaging cross-sector partners to address disparities in those systems. And so we're really looking forward to talking with you today about the ways that NVRDC has successfully built community connections to meet the health needs of survivors of domestic violence, and how the lessons you've learned throughout the last 8 years might apply to members of our cohort who are implementing equity-related projects within their own communities. So thank you so much for joining, and I'm really excited to talk with you today.
Yeah, thank you so much for having me. And I'm just so grateful, Brittany, for the important work that you all are doing, and hoping that we can have a good conversation that's hopefully helpful.
Awesome. Well, to start, we'd really like to get your perspective on the types of services that individuals currently experiencing domestic violence or survivors of domestic violence might need when it comes to accessing health services or access to food. And what gaps you've seen in meeting those needs over the last several years.
Yeah, that's a great question. And of course, one thing that I'll try to highlight in our conversation is how the gaps now look very different than they even did 6 months ago, right? Just given the current reality that survivors are dealing with during a global pandemic, even as communities have gone sort of back to more normal than we were 6 months ago. There are still some pretty different challenges. But in terms of the survivor experience to health access, one of the things that we do at NVRDC is that our advocates offer the 24/7 crisis response for any adult survivor who's accessing a forensic medical exam. That's commonly referred to as a rape kit. And for us, that is a response that our advocates will offer, going to the hospital emergency department, triaging with the forensic nurse, and law enforcement if that survivor has decided to report, but of course they get to make that decision. And what's interesting to note is that typically we see about 15% of all of our responses to that program are related to domestic violence, sexual assault. So sexual violence that's being committed by a current or former partner. I will note that that percentage actually increased during COVID. It was about 30% of all exams, not surprising given what we know about the lethality increase over the last few months. But what we often see is that survivors have to make really difficult decisions about whether or not to access healthcare, particularly if it's in the acute moment, right? So if they have an urgent physical need, physical health need, and they need to go to the hospital and access either medical care or something like a forensic exam, if they have children, right, what are the choices they're making about whether or not they can actually access those services? And so I would really like to encourage communities that do have really helpful, comprehensive, acute, medical healthcare resources available, that they're thinking about some of those tangential barriers, like, is there an ability for someone to provide childcare? We've even been brainstorming, can we have a childcare providing company that we've already vetted that's on, sort of standby so that we can cover the childcare costs as this individual is needing to access healthcare? I think those are like important questions that communities need to grapple with. And, in this moment, in addition to thinking about kind of real-time challenges accessing healthcare services, whether it's acute or otherwise, I think there's a gap to consider about telehealth, right? Many programs, whether that's a kind of acute forensic program or even just providers, like, you know, kind of preventative healthcare that someone might access, are often requiring that individuals do that via telehealth. And I think that's a trend that we'll continue to see for, you know, all communities. But for survivors, if their abuser is controlling their technology, whether or not they have a phone, whether, you know, and if their abuser doesn't want them to see the doctor because there's visible, you know, physical bruising or some other indicator of abuse, their ability to even access telehealth could be, you know, challenging. And if they don't have technology to be able to do that, and that's what providers are sort of expecting, we have to really be conscious of how that sort of shift in technology to make really healthcare more accessible could actually be an added barrier for survivors of domestic violence. So that's sort of how I think about the health components of that question. I think as it relates to food security, you know, a couple of things have come up for us related to, we have a survivor support fund. So when survivors need emergent kind of financial assistance that's not able to get covered through other community programs or crime victims compensation, we have an emergency fund that we will tap into. We saw a pretty big increase in requests for emergency groceries and even things like clothing for children that they couldn't get through a normal, you know, kind of clothing drive that was available pre-COVID. Same thing with food. If you're working with survivors who are, you know, immune compromised and they may not have the flexibility to go out and actually do pick up, I think for resources in communities that offer kind of food services, thinking about, do they do walk-up availability for pickup? Do they have a drive-up availability for survivors that are maybe having more challenges accessing the services because of an immunocompromised situation? But also just the reality of, again, to what extent does the abuser have the ability to control the time in which that survivor is able to access, you know, food resources, the mobility of their ability to have transportation. There's just so many questions that I think I would really, again, want to encourage communities to not only do a landscape assessment of what are the resources for food security for the entire community and for survivors, but then to partner with those domestic violence programs and say, what if we surveyed survivors that you've worked with in the last 6 months and asked them, what have the barriers been for you? What resources could you have used? And I think really thinking about how, to your kind of introductory point, how do we actually center survivors' needs by asking them and those who are serving them what's working and what we could do better. I said a lot of words.
No, thank you. That was incredibly valuable insight that you just shared. And, you know, I think that that's one question that I have for you is, you know, how are you approaching community outreach and engagement, especially during this time of the pandemic and, you know, the barriers that already exist in reaching survivors of domestic violence or individuals who are currently experiencing violence? Mm-hmm. And you know, what would you recommend to frontline workers in the community who want to try to engage with this particular population?
Yeah, I have so many thoughts about this one. I think this is a historical challenge for everyone doing kind of anti-gender-based violence work, right? Often those on the front lines, whether it's a hairdresser or a restaurant worker, right? Like someone who's going to have a very ad hoc, maybe you know, limited interaction with us might actually be the best situated to really see indicators of violence and provide resources and information. So I love that you have this question in this dialogue today. And I do have some specific thoughts, but I really think that we need to think more broadly about where we do outreach as service providers, right, in the sort of anti-gender-based violence space. And so one of the things that NVRDC just launched, which I'm incredibly proud of, but can take no credit for because we have an amazing team, is something called I Empower. And it's an entire program through a seed grant that was funded to both survey OBGYN providers. And this was based on research that survivors of sexual violence, whether committed by a current or former partner or otherwise, are much less likely to seek preventative OBGYN care. Actually, like a huge percentage of them will fail to seek preventative care. And when we started to assess why, there were a lot of questions about, how do you know that the provider you're going to is trauma informed, that they know how to ask screening questions about whether or not you've experienced violence? And so we developed an entire survey that we were pushing out to care providers themselves to assess what education they get, what training they have, what their soft skills are, what their environment in their office looks like for survivors. And then we're also surveying survivors, but the goal of this is that we've actually developed, in partnership with our forensic nursing program, a curriculum that we will then provide to these provider offices, and then we'll have this interactive online tool that survivors themselves can go to and say, hey, I want to go to this office because I know they've gone through the trauma-informed training. So I think it's almost this, it's like a sort of parallel world in terms of outreach. We can't just think it's enough to give someone a pamphlet or a brochure or information. I think as frontline workers, whether you're in healthcare or food service, or any other kind of service industry, we have to actually equip you with the education and tools to navigate when a survivor does disclose, or when you do find indicators of abuse, then what, right? That response is really, really important. Not only is it important from connecting that survivor with resources, but there's actual research that shows the way in which someone responds to a disclosure of abuse or sexual violence will literally indicate for that person whether or not it's safe to keep telling their story, right? And so equipping frontline individuals with the tools to respond in a trauma-informed way is a really great way to continuing and really creating safe spaces for survivors to access support and care. And thinking about some specific examples, as a frontline worker in any service industry, if I have a regular client, what I would say to them and what I would think about in training is, if you've seen someone regularly and they've never canceled appointments, and all of a sudden that's shifting, right? Think about how you check in with them about that. Has anything changed with you? I've noticed you haven't been coming as regularly. Like, what are the sort of organic ways that we can create conversation for survivors to ask for help? That might be one sort of like key takeaway. I think there are other things, thinking about the way in which someone is showing up to frontline workers. So are they exhibiting signs of stress about the length of time that this appointment is taking? Or are they exhibiting signs of anxiety around how long a service is taking? And again, checking in about, it could just be they're rushed, right? Like, we don't want to assume the worst, but I think what we always want to do, and encouraging anyone to be on the front lines responding for survivors, is to center their choices and give them opportunities for empowerment. And so the best way to do that is to ask the question, hey, I see that you feel I'm observing that you're a little bit stressed and you're trying to get out of here. Is there anything I can do to help? Is there, just anything to open the door to have the conversation about what might be sort of that pressure point for that individual. But also, like, other indicators might be changes in hygiene, changes in their weight. Are they sort of having stress indicators that internally are showing up for them? Of course, any visible physical injuries where there might be a presentation of trying to explain them away. That doesn't always, of course, mean that abuse is happening, but those can be indicators that we want frontline staff trained to both recognize and then feel prepared and equipped to respond to.
Thanks, Bridget. With the theme for Domestic Violence Awareness Month being listening from home, I think that those are some really helpful tips for those of us who may be engaging with members of the community to have an idea of what to look for, especially during the pandemic when individuals experiencing violence might be more isolated, and so family and friends may not be picking up on some of those signs that you just talked about. Do you have any tips for where someone who's interested in learning more about recognizing these signs or getting training for where they could go to find those tools or resources?
Yeah, we're so lucky that, there is a domestic violence, sometimes it's a dual domestic violence sexual assault coalition in every jurisdiction, right? And so you'll have kind of your state-wide coalition to respond to domestic violence and/or sexual assault. And they're a great resource that is really community specific. You're going to know where county by county resources exist, both for acute services and more long-term services. And so knowing your local coalition is a great starting point, and they'll often be the kind of connector to your local community services. We of course have a national coalition that helps also provide technical assistance, but I would really say that if you're looking for that community touch point, starting with that local coalition is a great starting point.
Perfect, thank you. So one last question for you. So as part of Domestic Violence Awareness Month, we're encouraging the communities who are participating in the Healthiest Cities and Counties Challenge, and cities and counties around the country who might be listening to this interview or reading up on our blog, to join the Domestic Violence Awareness Project's call to choose one thing that they can do to prevent domestic violence and support survivors. So if you were going to suggest just one action that any community organization could take to start thinking about how to integrate violence prevention into their work, where would you recommend that they start?
Yeah, that's such a good question. I have so many things. It's really hard to pick one. And in my little cheat list here, I was like, oh, all of these things. But I really think, as I try and center like what we try and live as a philosophy at MVRDC, is like recognizing that we can't be the expert of all things for all survivors, but there are people out there that are really well versed in recognizing and responding to intimate partner violence, dating violence, domestic violence. And so find out who your local service provider is, right? Who is on the front lines, really equipped and trained to respond to survivors' needs as it relates to domestic violence, and partner with them. Invite them in for a brown bag. Say, hey, just give us like tips on what do you recommend as, the sort of top 3 ways to recognize and respond to indicators, whether that's environmental indicators, sort of victim indicators, disclosures, and just create the partnership as really, I would say, like a starting point to a long-term collaboration. Because I will just note that as we do our work at MVRDC, the more partners we've brought to the table to both teach us to do our jobs better, but it's also allowed us to have more of those resource connections for the survivors that come to us and needs a service that we don't offer. And so my number one recommendation is be the person to reach out to that program in your community and say, hey, we don't do domestic violence necessarily, we don't focus on it, but you all do, and we'd love to bring you in and teach us about how we can help you do the important work that you're doing.
Fantastic. Well, Bridgette, thank you so much for joining us today to have this conversation. I feel like I could ask you a million more questions because you have such a wealth of knowledge, and I just want to express my appreciation for all that you and your team are doing to support members of our local community here in DC. So.
Oh, thank you. And same to you. Like, it's just so awesome to see. I think just like the theme for Domestic Violence Awareness Month, we all really can do both little and big things. And the fact that you all are taking such a focus on this in your work, I think is a real testament to living out what does that mean? What does it mean to center this in our work? So I'm really appreciative of that. And I'm glad that I got to hang out with you and always available as a local resource here in the district, but I'm happy to continue to be a resource if people have follow-up questions as well.
Wonderful. Thank you so much.